Hello everyone, I hope you're all doing well. I'm Hajar Razug and welcome to our new episode on Psycho Talks, which is about bipolar disorder, where we're going to tackle the main aspects of bipolar disorder, symptoms, causes, risk factors, and treatments. Well, first of all, what are bipolar disorders? Bipolar disorder is a brain disorder that causes changes in a person's mood, energy, and ability of function. People with bipolar disorder experience intense emotional states that typically occur during distinct periods of days to weeks, called mood episodes. These mood episodes are categorized as a manic, hypomanic, abnormally happy or irritable mood, or depressive, which means sad mood. People with bipolar disorder generally have periods of neutral mood. As well, when treated, people with bipolar disorder can lead full of productive lives. There are three types of bipolar disorder. All three types involve a clear change in mood, energy, and activity levels. These mood range from periods of extremely up, elated, irritable, or energized behavior, known as manic episodes, to very down, sad, indifferent, or hopeless periods, known as depressive episodes. Less severe manic periods are known as hypomanic episodes. Bipolar 1 disorder is defined by manic episodes that last at least 7 days, most of the day, nearly every day, or by manic symptoms that are so severe that the person needs immediate hospital care. Usually depressive episodes occur as well, typically lasting at least 2 weeks. Episodes of depression with the mixed features, having depressive symptoms and manic symptoms at the same time, are also possible. The experience of 4 or more episodes of mania or depression within a year is termed a rapid cycling. Rapid, like bipolar 2 disorder, is defined by a pattern of depressive episodes and hypomanic episodes, but the episodes are less severe than the manic episodes in bipolar 1 disorder. Cyclothymic disorder, also called cyclothymia, is defined by recurrent hypomanic and depressive symptoms that are not intense enough or do not last long enough to qualify as hypomanic or depressive episodes. Signs and symptoms of bipolar disorder. People with bipolar disorder experience periods of unusually intense emotions, changes in sleep patterns and activity levels, and uncharacteristic behaviors, often without recognizing their likely harmful or undesirable effects. These distinct periods are called mood episodes. Mood episodes are very different from the mood and behaviors that are typically for the person during an episode. The symptoms last very day for most of the day. Episodes may also last for longer periods such as several days or weeks. So what are the symptoms of manic episode? Feeling very up, high, elated or extremely irritable or touchy, feeling jumpy or wired, more active than usual, decreased need for sleep, talking fast about a lot of different things, flight of ideas, racing thoughts, feeling able to do many things at once without getting tired, excessive appetite for food, drinking, sex, or other pleasurable activities, feeling unusually important, talented, or powerful. Symptoms of depressive episode: feeling very down or sad, anxious, feeling slowed down or restless, trouble falling asleep, waking up too early or sleeping too much, talking very slowly, feeling unable to find anything to say or forgetting a lot, trouble concentration or making decisions, feeling unable to do even simple things, lack of interest in almost all activities, feeling hopeless or worthless, or thinking about death or suicide. Sometimes people experience both manic and depressive symptoms in the same episode. This is called as episode with mixed features. People experiencing an episode with mixed features may feel very sad, empty, or hopeless, while at the same time feeling extremely energized. Now, what are the causes of that? So, the exact cause of bipolar disorder is unknown, but several factors may be involved, such as biological differences. People with bipolar disorder appear to have physical changes in their brains. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Genetics. Bipolar disorder is more common in people who have first-degree relatives, such as siblings or parents, with this condition. Researchers are trying to find genes that may be involved in causing bipolar disorder. The risks of this, or the risk factors, which are having first-degree relatives such as a parent or sibling with bipolar disorder, periods of high stress such as the death of a loved one or another traumatic event, drug or alcohol abuse. Complications. Left untreated, bipolar disorder can result in serious problems that affect every area of your life, such as problems related to drugs and alcohol use, suicide or suicide attempts, legal or financial problems, damaged relationships, poor work or social performance. Co-occurring conditions. If you have bipolar disorder, you may have another health condition that needs to be treated, along with bipolar disorder. Some conditions can worsen bipolar disorder symptoms or make treatment less successful. Examples include anxiety disorders, eating disorders, attention and hyperactivity disorder, alcohol or drug problems, physical health problems such as heart disease, thyroid problems, headaches, or obesity. Treatment and therapies. Treatment can help many people, including those with the most severe forms of bipolar disorder. An effective treatment plan usually includes a combination of medication and psychotherapy, also called talk therapy. Bipolar disorder is a lifelong illness. Episodes of mania and depression typically come back over time. Between episodes, many people with bipolar disorder are free of mood changes, but some people may have lingering symptoms. Long-term continuous treatment can help people manage these symptoms. What kind of medications? Certain medications can help manage symptoms of bipolar disorder. Some people may need to try several different medications and work with their health care provider before finding medications that work best. The most common types of medications that doctors prescribe include mood stabilizers and typical antipsychotics. Mood stabilizers such as lithium or valproate can help prevent mood episodes or reduce their severity. Lithium also can decrease the risk of suicide. Medications that target sleep or anxiety are sometimes added to mood stabilizers as a part of a treatment plan. While bipolar depression is often treated with antidepressant medication, a mood stabilizer must be taken as well, as antidepressant alone can trigger a manic episode or rapid cycling in a person with bipolar disorder, because people with bipolar disorder are more likely to seek help when they are depressed than when they are experiencing a mania or hypomania. Taking a careful medical history is essential to ensure that bipolar disorder is not mistaken for depression. People taking medication should talk with their healthcare provider to understand the risks and benefits of the medication. Tell their healthcare provider about any prescription drugs, over-the-counter medications or supplements that they are already taking. Report any concern about side effects of healthcare provider right away. the healthcare provider may need to change the dose or try different medication. Remember that medication for bipolar disorder must be taken consistently as prescribed, even when one is feeling well. Avoid stopping a medication without talking to a healthcare provider. First, suddenly stopping a medication may lead to rebound or worsening of bipolar disorder symptoms. For basic information about medication, of course, you need to check a lot about that. Psychotherapy. Psychotherapy, also called talk therapy, can be an effective part of the treatment plan for the people with bipolar disorder. Psychotherapy is a term for a variety of treatment techniques that aim to help a person identify and change troubling emotions, thoughts, and behaviors. It can provide support, education, and guidance to people with bipolar disorder and their families. Cognitive behavioral therapy is an important treatment for depression, and CBT, adapted for the treatment of insomnia, can be especially helpful as a component of treatment of bipolar depression. Treatment may also include newer therapies designed specifically for the treatment of bipolar disorder, including interpersonal and social rhythm therapy and family-focused therapy. Determining whether intensive psychotherapeutic intervention at the earliest stages of bipolar disorder can prevent the limit. Its full-blown onset is an important area of ongoing research. Other treatment options, which are electroconvulsive therapy, ECT, is a brain stimulation procedure that can help relieve severe symptoms of bipolar disorder. ECT is usually only considered if an individual's illness has not improved after other treatments, such as medication or psychotherapy. The second one, which is transcranial magnetic stimulation, TMS, is a type of brain stimulation that uses magnetic waves rather than the electrical one to relieve depression over a series of treatment sessions. Light therapy is the best evidence-based treatment for seasonal affective disorder, and many people with bipolar disorder experience seasonal worsening of depression in the winter, in some cases to the point I've said. Light therapy could also be considered for lesser forms of seasonal worsening of bipolar depression. How to cope with bipolar disorder? Living with bipolar disorder can be challenging, but there are ways to help you to make it easier for yourself, for a friend or a loved one. So get a treatment and stick with it. Treatment is the best way to start feeling better. Keep medical and therapy appointments and talk with your healthcare provider about treatment options. Take medications as a direct. Structure activities. Keep a routine for eating, sleeping, and exercising. Try regular vigorous exercise like jogging, swimming, or bicycling, which can help with depression and anxiety. Promote better sleep, and it's healthy for your heart and brain. Keep a life coach or help recognize your mood swings. Ask for help when trying to stick with your treatment. Be patient. Improvement takes time. Social supports help. So remember, bipolar disorder is a lifelong illness, but long-term ongoing treatment can help control symptoms and enable you to live a healthy life. Stay strong, stay purple.